So good morning, everybody. Welcome to the rulemaking session for the All-Payer Claim Database. I'm Kim Bimsteffer, the Executive Director of the Department of Healthcare Policy and Financing. And it's an honor to spend time with you all today. Thank you in advance for all the time you've spent with Civic, working through the rules and providing your input and getting us to where we are today. The Q&A feature is enabled for the webinar. If you're listening via the audio stream and lose connection, just click on the link again. You'll be able to rejoin. If you want to provide testimony after the rule is presented, you are welcome to do so. So the rule being presented today proposes new data submission requirements to the Colorado All-Payer Claim Database through revisions to the Data Submission Guide, or DSG. This year's annual rule change proposed by the APCD submission guide and regulation has three primary goals. One, strengthen compliance expectations and clarify submitter responsibilities to ensure timely, accurate, and complete submissions across all reporting entities. Implement structural and operational updates required for the transition of OnPoint Health data as the state's new data management vendor, including updated file names, conventions, submission processes, and system requirements. And three, support increased alignment with the APCD Common Data Layout, or CDL, to improve interoperability, standardization, and long-term consistency across state and national reporting frameworks. Again, thank you for your stakeholdering on the proposed rules. Civic has made some adjustments based on your input, and I've asked today's rule presenter to address those comments and concerns during the rule presentation today. And with that, I'd like to transition this to Kristen Paulson, who's the CEO of Civic, who will present today's rule revisions. Ms. Paulson, please introduce yourself for the record and present the rule revisions.
Thank you, Executive Director Bimsteffer. My name is Kristen Paulson, Chief Executive Officer at the Center for Improving Value in Healthcare, or Civic. We are the state-designated administrator of the All-Payer Claims Database for the state of Colorado. On behalf of Colorado and by appointment from the Executive Director of the Colorado Department of Healthcare Policy and Financing, or HCPF, Civic administers the Colorado All-Payer Claims Database, or APCD, the state's most comprehensive source of healthcare insurance claims information and one of the most robust APCDs in the nation. The Colorado APCD represents the majority of covered lives across commercial health insurance plans, Medicare fee-for-service, Medicare Advantage, and Medicaid in the state of Colorado. As administrator, Civic is required by statute to maintain and enhance the database while providing public reports, consumer tools, and custom data analysis intended to identify ways to improve the health of Coloradans, enhance the quality of care, and lower the cost of healthcare. On an annual basis, Civic, in collaboration with commercial health insurance plan submitters and HCPF, proposes new data submission requirements to the Colorado APCD through revisions to the Colorado Regulatory Guidance and the Data Submission Guide, or DSG. These revisions are intended to enhance the quality, usability, and comprehensiveness of the dataset to provide more benefit to Colorado. Last year, Civic published a nationwide request for proposals for a data management partner for the Colorado APCD and selected OnPoint Health data. This year, Civic is executing a transition from our previous data management vendor to OnPoint. OnPoint bases much of their data structure on the APCD Council Common Data Layout, or CDL. This data layout standard forms the basis of many APCD submission structures and is increasingly being adopted in order to ease the submission process for payers responding to multiple APCDs. Many of the DSG changes this year support better alignment between the CDL and the Colorado APCD data submission layout and should help facilitate smoother, more consistent data submissions. Annual DSG and regulatory updates through the HCPF rulemaking process allow Civic to increase the value of the Colorado APCD by ensuring that the data is as robust, accurate, and useful as possible. This year's rule changes will help Civic further the legislative intent of the Colorado APCD by improving the quality and completeness of submitted data, to advance the integrity and credibility of the Colorado APCD, and to support those working to improve health, improve quality, and reduce healthcare costs for Coloradans. I'm now going to provide a summary of the payer engagement and feedback leading to the hearing. In preparation for this hearing, Civic has held 3 Payer Connect calls on June 18th, 2025, August 20th, 2025, and October 15th, 2025, to describe the proposed changes to the rule and the DSG, to address input from the payers and answer any questions. In addition, we had a virtual public review meeting on October 27th of 2025, where we received questions and comments from payers regarding the proposed changes. In general, comments and questions fell into one of two categories. First, submitters asked for clarification regarding the strengthened compliance language included in DSG version 17. Payers sought clarity on several of the compliance-related updates to ensure they fully understood what would be required of them when submitting data to the Colorado APCD. Submitters specifically asked for clarification on the definition of a Colorado resident, and Civic provided additional explanation to ensure consistent application of this definition across all payers. These compliance-focused updates were intended to improve consistency, strengthen accountability, and reduce variation in how payers meet their CO-APCD reporting obligations. Second, we reviewed questions and comments related to the structural DSG 17 changes required for the transition to OnPoint Health Data as the new Colorado APCD data management vendor. These updates reflect the necessary changes to support Civic's transition to OnPoint as a new data management vendor and are almost entirely in alignment with the common data layout. Specifically, payers sought clarification on the new monthly and annual file naming conventions, particularly the portion involving record counts and version numbers. In response, Civic updated the requirement so that the record count is only required for files without header records, the annual APM contract information or AC file, the annual pharmacy benefit manager contract information file or PB file, the prescription drug affordability board file, PD, and the pharmacy value-based purchasing contracts, the VB files. For all other files, a value of 0 will be accepted if payers cannot provide the record count. Additionally, OnPoint confirmed that all files are time-stamped upon receipt, and this timestamp is used to version the files. I'm now going to review the summary of our proposed changes. I will summarize the changes we are requesting that Executive Director Bim Steffer approve in this hearing, focusing on the value that these new elements will bring to the reporting capabilities of the Colorado APCD. In summary, in this rule change, we are requesting a total of 2 changes to the definitions and 2 changes to the reporting requirements. In the DSG, we are requesting a total of 15 changes to the compliance and reporting requirements, 2 new fields associated with header records, 1 new field associated with the trailer records, 1 update associated with the monthly medical claims file submissions, 1 update associated with the monthly pharmacy claims file submissions, 1 update to the annual APM contract information file submissions, 2 updates to the capitation file submissions, and 3 updates to the Exhibit B lookup tables. Starting with the rule, there were 2 changes to the definitions. First, under the definition for submission guide, the version has changed from version 16 to version 17. Second, under the definition for submission guide, the effective date of submission guide 17 is changed to March 2026. Next, there is 1 change to the reporting requirements. We've updated the date to release premium and deductible data beyond the Colorado Division of Insurance to June 2027 to allow for additional time for data validation. Moving on to the DSG, I will now outline the changes made to the compliance and reporting requirements. First, we clarified that payers must report paid, partially paid, and fully denied claims across all relevant files and file types. Second, we clarified that off-boarding payers are required to submit 6 months of runout data before discontinuing submissions. Third, we added clarification around the definition of a Colorado resident to support consistent reporting. Fourth, we added CDT procedure codes to the list of required HCPCS procedure codes for MC055, outpatient procedure code, to ensure consistent reporting of dental procedures. Fifth, we updated the wording for certain data elements to ensure consistent instructions for when fields should be left blank as appropriate. Sixth, we updated the date format from CCYYMMDD to YYYYMMDD to ensure consistent reporting instructions across all date fields. Seventh, we clarified expectations for annual file submissions, including test file requirements, waiver procedures, and submission deadlines. Eighth, we added the requirement that payers must acknowledge Civic's notification of an issue within 3 business days for all file types. Ninth, we added the requirement that all data must contain only standard ASCII characters, and that extended or non-printable characters must be removed prior to submission. 10th, all files previously submitted in Excel format, including AC, PB, PD, and VB files, must now be submitted as CSV files. 11th, we clarified that the first row of every file must never contain data element labels such as MC001. This applies to all files. 12th, we introduced a new payer code naming convention. Under this new structure, the payer codes begin with a 3-letter prefix followed by the existing 4-digit payer identifier. Specifically, the 3-digit prefix COC for commercial carriers, COG for government agencies such as Medicare or fee-for-service or Medicaid, and COT for third-party administrators and pharmacy benefit managers. The 3-letter prefix indicates the type of payer, and the suffix will be the existing 4-digit civic payer code. 13th, we introduced a new monthly file naming convention, which now includes payer code, file type, reporting period dates, row count, production flag, fixed width indicator, and a file creation date. If a payer is unable to fill in the row count for monthly files, a value of 0 is acceptable. 14th, we introduced a new file naming convention, which now includes payer code, file type, reporting period dates, row count, production flag, fixed width indicator, and file creation date. If a payer is unable to fill in the row count for alternative payment model, APM total control total file, drug rebate file, or capitation files, a value of 0 is acceptable. A non-zero row count is required only for files that do not contain header records, including the APM contract information file, the AC file, or PB, VB, and PD files. 15th, we added the requirement that new payers complete an initial registration form and that all payers must complete annual registration. Next, there are 2 changes made to all file header records. First, we added HD002, a new file type field to the header record to indicate the file type. As a result, all subsequent header element numbers will shift down by 1 through HD001. Second, we added HD012, a new test file flag in the header record to indicate whether a file is test or production. Next, there is 1 change made to all file trailer records. First, we added TR002, a new file type field in the trailer record with a corresponding renumbering of all subsequent trailer elements through TR007. Next, there is 1 change made to the medical claims file. We updated MC017 so that the date service approved, accounts payable date, actual paid date, or denial process date is now required for all claims, including fully denied claims. Next, there is 1 change made to the pharmacy claims file. First, we updated PC017 so that the paid date or denial process date is now required for all claims, including fully denied claims. Next, there is 1 change made to the annual APM contract information file, or the AC file. We corrected AC014 payment subcategory, which had previously been labeled incorrectly as payment category. Next, there are 2 changes made to the annual member capitation file, or the CF file. First, we updated CF010 with a new data element name and description to the following. Data element name to member identification code. Description is a unique identifier such as the Medicaid ID, which must be unique to the member. This element is now explicitly aligned with ME011, the member number. Second, we renumbered CF999, which was previously labeled as CF019. Lastly, I'll discuss our proposed changes to the Exhibit B lookup tables. First, we added 3 new Medicare special needs plan insurance type codes, including S1 for chronic conditions, S2 for institutionalized, and S3 for dual eligible. Second, we added 3N and 4N to the APM categories lookup table to support the reporting of non-value-based alternative payment models. Third, we added D7, D8, E9, 3N, and 4N to the APM subcategories lookup table. D7, D8, and 3N were added to allow more specific categorization of capitated arrangements in the capitated member file. 3N and 4N were added to support reporting of non-value-based alternative payment models. In closing, as the administrator of the Colorado APCD, Civic is committed to continuing to deliver timely, actionable, and transparent data and information to support positive changes in the Colorado healthcare system. This year's changes to the DSG will advance the overall quality and completeness of the Colorado APCD, improve transparency into Colorado's healthcare system, and support innovations that will lower costs and improve care and the health of Coloradans. These updates will also help ensure a smooth and successful transition to Civic's new data management vendor, OnPoint Health Data, and increased alignment with a common data layout. Thank you. My colleagues and I are happy to answer any questions that the Executive Director or the public may have.
Thank you, Ms. Paulson. It was very effective and very thorough. We're now ready to take any comments or questions from public testimony. Please sign up and provide testimony if you've not done so already. There is a sign up place on the web page. There's a link to the sign up sheet in the chat. If you need assistance, raise your hand or put something in the Q&A feature, and we will make sure you can get connected so that you can testify today. There's also a 5-minute limit for testimony. And to all those who testify, please identify yourself before you make the comments so that we have your name for reference in the public record. So, Chris, who do we have signed up to testify?
This is Chris Sykes. At present, we don't have anybody signed up to testify.
Okay, let's give them a minute to make sure they can get the hand raised or find the link or put something in the chat, please.
And this is Chris Sykes again. Yes, Kelly has enabled the raise hand for participants if they'd rather go that way.
Okay, if we can't use the function. Okay. Thank you, Kelly.
Sometimes that's a little faster.
And I'll give them a minute. Chris, still nobody that wants to be heard?
This is Chris Sykes. Still not anybody online for questions.
Okay, given that, I think that's a reflection of really good stakeholdering. So thank you very much, Ms. Paulson and your team, all of the civic team. Thank you very much, carriers and payers, for your engagement. That's a great reflection for things to go so smoothly. So given that, I'm banging a virtual gavel and I'm saying I adopt the rules as they are written effective March 1st, 2026. So to summarize, this year's changes include the following: strengthening, clarifying compliance and reporting requirements, including but not limited to expectations for reporting, fully denied claims and runout requirements, updates associated with transition to on-point health data, including but not limited to introducing new payer codes and new monthly and annual filing name conventions, new header and trailer records, annual payer registration requirements, and 3, expanding the Exhibit B lookup tables for insurance product type and APMs, or alternative payment model, categories and subcategories. Overall, this year's DSG the changes that have been made just today, as we formalize them, will enhance the quality, usability, and comprehensiveness of the Colorado APCD, and I appreciate everybody's efforts together to be able to do that. And with that, it concludes the meetings today. Thank you again, and happy Thanksgiving, everybody.